me today is Dr. Mukanga. I will introduce myself and I'll have her introduce herself and we'll get started with this amazing topic we have today about oral health and gum disease. I'm Dr. Lumfundi. I'm a pediatrician and founder of Generational Wellbeing, online platform where I help parents with picky eaters, help them give them simple strategies on how they can help improve their kids' eating habit. I am joined today by Dr. Makanga. As I said, I'll have her introduce herself and then we'll get started.
Hi, thank you so much, Dr. Loom, for having me on your podcast. I really, truly appreciate it being on your platform. I feel special.
You
So
are
thank you.
special.
Thank you. But I'm Dr. Valerie Mukanga. I'm a general dentist and the owner and founder of Healing Wings Dental. It's a place where we help our patient maintain and regain their oral health and also their smile so they can soar in life. We are located in Arlington, but yeah, pretty much I'm a general dentist. And so we take care of the mouth, whether for kids or adults alike.
Everybody, right? I love it. So, today, what I really want us to talk about is gum disease and inflammation because we hear about inflammation as it relates to all these chronic disease conditions from heart disease, diabetes, thyroid, and everything. But sometimes we really fail to understand that everything it starts out in the mouth. So, tell us, what is gum disease?
Yeah, so gum disease is pretty much another type of inflammation, but it actually affects your mouth or it affects your gum, right? And everything that's underneath. So, gum disease is twofold. You have diseases that is pretty much at the level of the gum, and that's called gingivitis. That's where, you have inflammation there. It hasn't yet affected your bone. And then the second level would be periodontitis, fancy word for infection at the bone level, which is the bone structure that actually supports your teeth and is hidden under your gums. So that's also where you have inflammation, and that's what you call, as the big umbrella, gum disease. The gum infection and also bone that supports your teeth infection on that level.
Amazing, thank you. Bone, that sounds like it's really deep in there. And once you're thinking about bone, you're thinking now systemic, right? Where
Right.
that inflammation can then move from the mouth into different organs of the body.
Exactly. And that's really, as you said, you're thinking about inflammation, you're thinking about, your body. But I mean, not that if you just took somebody off the street and said, is your mouth connected to your body? You're like, well, duh. But, when it comes to disease process, we kind of separate things. And I don't know where it comes from. It could be just because, here in the US, like healthcare is sort of divided, whereby even with insurance you have health insurance and you have your eye insurance and you have your mouth, as if it's really different. I think maybe that's the reason why, but it's all connected. Yes.
Right. And once you start, you gave us like the two different parts, starting with the gingivitis, which is that inflammation. What are those symptoms? What do you see when you get to that first phase?
Okay, so what you would see is that the telltale sign is that you're bleeding when you are brushing your teeth. And so many people see bleeding and they're like, oh, it's not necessarily that you have hurt yourself, although you may have, which is different. But usually, a telltale sign of, having gum disease would definitely be bleeding when you're brushing. And so normally when you're brushing your teeth, you're not supposed to bleed. Your teeth are supposed to be healthy. It's kind of like your skin. If you kind of like brush around, your skin, you shouldn't bleed. But if you see bleeding, that means there's a problem happening. Okay. Another sign is that you will see that you will have swollen gums in some cases. So if, because the gum can have different color, if you have pink gum, like I do, you would see that, it will be more red in color. It could be more darker pink in color as well. That's an indication that you have inflammation at the gum level. You could also see rolled up gum, so where it's kind of swollen, right? And so that's also a sign that you do have gingivitis.
Awesome. Yeah. And I see that. I think even with kids, right? It starts very early on, which is why we emphasize once you start having these teeth start brushing daily, because even with kids, you can still have that inflammation and gingivitis. Do you see that often in kids as well?
Oh, yes, we see that on kids a lot. You know, you have kids where you see a lot of plaque, and so they're not brushing properly. They have gingivitis when you brush, you see the bleeding or you see, swollen gums. Yes, so we do see that on kids a lot. Kids, as far as having periodontitis when they're young, that's very rare, although it can happen, but definitely gingivitis affects a lot of kids.
Let's see. Now, how long does it typically take from that stage where, from that gingivitis stage to a periodontitis stage?
So it's not possible to actually give like a time frame, say, after a year, because the disease process would depend or would vary depending on the patients, right? There's some people who suffer for gingivitis from time to time, where, they would really brush really good, and then maybe they're going through depression, or maybe they're going through whatever they're going through, and they stop, brushing properly. So it's difficult to say, okay, this is, the period of time after which you will be affected, and your bone being affected. But pretty much what we want to do is kind of like see the patient on a regular basis so it doesn't progress all that, fast.
Okay, so the main thing is to really prevent that progression with good oral hygiene.
Correct. Because if you do have gingivitis, Dr. Loom, gingivitis is reversible. So that means that if you only have the inflammation at the level of your gum, really, like, undertaking good oral care will ensure that the gingivitis reverses and you have healthy gum again. So that's why when you see that you're bleeding, you see, and especially with parents sometimes, or even some adults, they see bleeding, and so they're like, "Oh, I'm hurting my kid," or "I'm doing something wrong." No. That's when, if you see bleeding, that's when you should really, really, really start brushing, because after about 10 days, about 14 days, you'll see that the bleeding will stop. So, yeah, gingivitis is reversible, thankfully.
Good, awesome. That's good to know. So we talked about good oral hygiene. What does that really mean?
Good oral hygiene means that you definitely want to make sure that you're brushing your teeth properly. When I say, I put an emphasis on properly, because some people brush their teeth but they don't do it right. So you will see a lot of patients will come in the office and they're brushing their teeth. You will know that they're brushing their teeth because the surfaces of their teeth are like clean, right? But then whenever you go deep, you see all this bleeding happening. So you want to make sure that you aim the bristles of your toothbrush at a 45-degree angle between your gum and your teeth, and you're going to go in a circular motion or a sweeping motion, where you're sweeping all the debris from on your teeth stuck between your gum and your teeth away from the gum surface. So if you're talking about the bottom teeth, you want to sweep up. If you're talking about top teeth, you want to sweep down, so that you're making sure that you're removing all that debris that gets lodged between your teeth. That's number one, is brushing properly. And as far as brushing, you want to make sure that you're brushing twice a day. So morning and night. Night is very, very important, because at night we produce less saliva, because what saliva does is that it kind of makes it difficult for bacteria to adhere to your teeth. So because we have less saliva at night, now bacteria can adhere to your teeth better, and then, they can just raise a havoc on your teeth, causing cavities and even, producing gum disease. So you want to make sure you're brushing morning and night after you eat. And I say after
Right.
you eat because some people
Right.
brush their teeth and then they go they go and eat something and go to bed. You haven't really done a good job at that, okay? So you
Right.
want to make sure you brush your teeth after you eat, okay? And you want to make sure that you also floss. You want to floss areas between your teeth. You can use string floss, or you can also use flossers, but you have more better dexterity using like the string floss. But if you're not able to, it's better to use, those little flossers than not use anything. And the reason why that's important is because you are going to be removing the debris between your teeth where food gets stuck. And that's because the bristles of the toothbrush are too thick and they cannot go between your teeth. So that's important to do. Okay, so brushing at least twice a day. You want to floss at least once a day so that you ensure you're removing bacteria, you're removing food, you're removing plaque that gets lodged between your teeth. You also want to make sure that you go see a dentist at least twice a year if you have healthy gum or gingivitis only. But if you have periodontitis now, meaning that your bone has been affected and you have inflammation of bone where your bone has receded, then you want to make sure that you follow the recommendations of your doctor. They can maybe ask you to come back every 3 months, sometimes 4 months, so as to thoroughly clean, those areas so that the disease process doesn't keep progressing, making things worse to where now you end up having, mobile teeth and losing teeth as well. So those are the recommendations. But besides that, Dr. Loam, it's important to make sure that you drink plenty of water. You want to make sure that you eat properly. So everything that's good for your health, like healthy food, fruits and vegetables, those are good and will help you as well as far as it comes to your mouth.
Amazing, amazing tips. What I see we're talking, I remember growing up with brushing. It was this movement right here where you're just brushing left to right, left to right. I'm like,
Right,
okay, no doubt you see a lot of inflammation because you're just dealing with the surface and not really going in at that angle, like you explained, to really get that debris out. But it's just,
right,
and that's what most people really just do, and we're just
right,
counting and going.
right,
So it's really important. That was a great tip there, just to understand how to brush because
right.
there are a lot
And
of people.
about how to brush, you want to make sure that you do that for all the surfaces of the teeth that you see. So that's going to be the outside surfaces that we see when we smile, the inside part as well, that is close to the palate or to the tongue. You want to make sure you brush that. You want to make sure that you're brushing also the chewing surfaces of your teeth. That way your teeth are thoroughly, taken care of and clean.
Yeah, I think that's a big problem with kids, and which what we see about not brushing properly. And then the other thing you really talked about too was brushing and then going to sleep, not brushing and going to eat. Because I've seen people who do the oral hygiene and then they have that bottle of milk right before bedtime, and then we have that milk sitting in there, and like you explained, without the saliva at nighttime, increased risk of cavities, even though you're brushing twice a day, but then
Right.
you're adding that milk after and wondering like, oh, I brushed, but I'm wondering why is my kid still having this gum disease or cavities and stuff.
Right. And Dr. Loom, the reason why they don't really think, that they're doing something wrong is because you mentioned milk, right? So they would be more they would understand better if they were talking about I'm giving my child like some candy, some chocolate before they go to bed, or even some orange juice. They don't realize that even milk has enough sugar in it, natural sugar in it, to cause cavities. And that's when you see a lot of kids, having baby bottle syndrome, where they have cavities because the parents are giving them milk for them to go to bed, but after that they're not wiping the teeth, and so even infants are developing cavities. There was a parent this morning who asked me. I said I did a checkup on his child, and I said, your child has no cavities. I'm happy to report that. And he said, so you mean to say that kids also get cavities? I say, yes, you would be surprised. There are some children who are taken to the OR, to be treated for cavities because they have so many of them. And that can
Yes.
come from the milk.
Yes.
Children less than a year old. And that's unfortunate.
It is, and it is very common. I forget the statistics now. I think at our last interview, I did go in there and look, but it is very common. We see it often in kids. I think almost on a weekly basis. I'm doing a clearance for kids to go to the OR because of that too. So
You would
okay.
know.
Yeah, I see a lot of that, which is why I'm really happy you're here to really talk to us, really that importance, not only for oral hygiene, but also how to do it so we prevent that progression to gum disease and then all the other complications that come through with it. What are some other complications if we're not, if we continue not to do the proper hygiene or if we continue not to go see our dentist to make sure we're getting the right care? Like, what are the other complications?
Right, there are many other complications. So you can have cavities, as we said. You can develop gum disease. You can have infection, and that's where it ties in a lot, like with the rest of the body, right? Because the inflammation in your mouth, if you have an infection in your mouth, rest assured that it's not just going to stay right there and stay put. All that those toxins are going to be traveling towards the body. All of those, you know inflammatory factors are going to be traveling through your bloodstream, and they can end up affecting it can affect your brain, it can affect your heart, it can exacerbate some diseases like diabetes. In fact, they have even found some mouth bacteria in the brain, and so it can even affect in areas such as like Alzheimer. There's so many things that can be affected, by this infection that you have in your mouth. So infection is a very big thing. You can end up, losing your teeth. And so when you lose teeth, that's a problem, right? If you're young enough, you can replace them. Thank God we can replace them. But, when you actually don't have or are missing some teeth or don't have any of your teeth, now you can't eat properly. You cannot speak properly because, believe it or not, you need your teeth to enunciate your words. So once you lose some teeth, it's not possible for you, to be heard well. My grandfather, for instance, he had only two teeth, for the longest, for the entire time that I knew him, he only had two teeth. And believe he had one tooth on top on this side and one tooth in the bottom on that side. Ask
Oh,
me how he loved to eat coconut, and he did. Okay, I don't know how he did, but he had his little knife and he would shred, and he loved to eat. So, for if you're a foodie, you want to say make sure that you keep your teeth, so you can end up losing your teeth. You can end up having like the shape of your face, is not going to be sunk in. So now, instead of looking younger, you may look older than you actually are. It can affect your self-esteem. It can cause you to have, mental health problem, like because you are now developing maybe like depression or anxiety because, you've had like some issues with your teeth or with your mouth. So yeah, there's many, many, many problems that can arise, from not brushing your teeth properly.
amazing tips there. Thank you. Now, one final question. I've had a lot of questions about the mouthwash.
Uh-huh.
Yes or no, and what do you recommend?
Okay, so I would say yes to mouthwash. It does help because it can also decrease the bacterial load in your mouth. Now, you have different types of mouthwash. Some of them have alcohol, so those tend to maybe like dry your mouth sometimes, and so you want to kind of like gauge and see which one would be best for you. I would say that mouthwash is definitely good. It's going to just enhance things. It's not as crucial as brushing and flossing and visiting your doctor, but anything helps. One thing it does, it will help you have good breath.
Absolutely. Well, thank you. Thank you. Any last tips before you leave, before we end this session?
I really thank you for having me here. I always want to let the world know that it's very, very important. So, oral health is a big deal. It can actually cause you such traumatic outcome. And one of the traumatic outcome that we experience in our family is that, as we're talking about the link between gum disease and also systemic disease, my uncle is my mother's brother. He ended up having infection in his mouth, and he didn't go see a dentist probably because of, it was back home where he lived, probably because of lack of information, maybe lack of finances. But when he finally couldn't take the pain anymore, he went to see a doctor, but it was too late. He actually ended up having a stroke. So while we're talking about, this important subject, it does happen that it can cause you to have, different type of problems. You can end up, you have your heart being affected, as I said, in his case, it was his brain. And it's not just that he ended up having a stroke and survived. He did not survive. He passed the same day, right? So I want to let the people know and sound this alarm that oral health is something that you don't really want to play with. It's definitely something that you want to instill in your children, show them how to do it yourself, so that, as being a billboard for your children and the rest of your family, things can, go for the up and up in your life, and you can definitely have the best smile that you can. It's not just, about having this perfect smile. It's really important. It's really important to take care of your teeth. It will help you, it will help your family members, it will help your entire life.
Thank you, and I'm sorry to hear about your uncle. And and
Yes.
and there's so many cases like that too, whether it's with stroke with that thrombus going up to the brain or down to the heart, where you have a heart attack too. I know with every year passing, we're now seeing that connection, especially down to the heart too, with plaques,
Right.
atherosclerosis, and stuff. Yeah. Can if someone's in your area, how can they find you?
Oh, thank you so much. So I'm Dr. Valerie Mukanga. You can find us in our office, Healing Wings Dental, and it's located in Arlington. The address is 4101 West Green Oaks Boulevard. The suite number is 317, and the zip code is 76016. That's in the big Dallas Fort Worth area. So Arlington is one of the surrounding cities of Dallas area. Okay, and you can also give us a call at 972-213-0202, or our website healingwingsdental.com. You can also find me on our social media platform, YouTube, Instagram, and that would be by just typing Dr. Valerie Mukanga, and you can ask us any question you want, and we'll try to help you and work with you.
Amazing, amazing. Thank you, and I hope we'll have part two sometime soon.
Oh, that would be great. I can't wait.